In this video, we are back with some crucial psychiatry PYQs. Try to answer each question in just 5 seconds. A brief explanation to the question will be provided after the correct answer is revealed. Let us know in the comments how many questions you get right. Let's start with the first one.
Question 1. A 38-year-old professor with depression requests you to prescribe an antidepressant that would be least likely to cause sexual dysfunction. Which of the following drugs would you prescribe? Here are the options. A. Bupropion, B. Escitalopram, C. Venlafaxine, D. Fluoxetine. And the correct option is A. Bupropion. Here is the explanation.
Bupropion is bupropion. Again, bupropion has low risk of sexual dysfunction or sedation or weight gain.
Question 2. What is the most common symptom of cannabis intake? Here are the options. A. Anxiety, B. Depressed mood, C. Dream-like state, D. Decreased appetite. And the correct option is C. Dream-like state. Here is the explanation.
Let's talk about cannabis intoxication. So, what are the effects one experiences in cannabis intoxication? There is a feeling, excessive feeling of euphoria. So, you may, many times, you might have seen someone, who has consumed, cannabis. So, they may, feel, very, high. So, they may have feeling of euphoria. There may also be sense of time distortion. Many of the times, patients report that they feel as if the time has slowed down. So, this may be seen. Then very important, especially, clinically you can see, and also in the questions you may get, there is redness of conjunctiva, there is conjunctival congestion. Again, patient in, intoxication, there is increased appetite. So many times family members may complain that, the person comes home and the eyes are red, the person is eating, a lot. So again, it may suggest that person might have consumed cannabis. Then there may also be symptoms of dry mouth, impaired motor coordination. So these are some of the cannabis intoxication. Other symptoms may also be seen like depersonalization. Person may feel, detached from self. So person may report as if I am watching myself in a movie. Or the person may, complain of derealization. Okay, that, there is detachment from the surroundings or the world. Sometimes hallucinations may also occur, but generally in reality testing is intact. Okay, person may know that, again, these might not be true. Okay, and there is, sometimes very infectious laughter. You may find someone, under intoxication, they're laughing, and the other people may also start laughing present nearby, or the person is talking a lot, talkativeness.
Question 3. You see a middle-aged man presenting to the psychiatry OPD who reports aliens have been speaking to him and telling him to kill his relatives over the past 7 months. The patient responded well to medication. What is the likely diagnosis? Here are the options. A. Mania, B. Delusional disorder, C. Schizophrenia, D. Brief psychotic disorder. And the correct option is C. Schizophrenia. Here is the explanation.
Now let us talk about the symptoms of schizophrenia. Okay. The first set of symptoms are positive symptoms. Okay. Positive symptoms. Let us talk about these positive symptoms. The first is delusion. As we had discussed in the basic, delusions are false, fixed, firm ideas or belief which is held with extraordinary conviction. Okay. So delusion, again, we know there are so many types of delusions. Most common delusion in schizophrenia is delusion of persecution. Delusion of persecution. Now there can be any type of delusion can be seen. Okay, the most common is delusion of persecution. There can be delusion of reference, even nihilism. All such kind of delusions can be seen. Okay, this is first positive symptom. Second symptom is hallucinations. Again, hallucinations, as we had discussed, these are false perception without any real object. Okay, again, hallucinations are of various types: auditory, visual, olfactory, gustatory, and tactile hallucination. And in schizophrenia, or any of these can be seen. Most common hallucination in schizophrenia are the auditory hallucinations. Of course, but other hallucinations can also be seen. The positive symptoms are also known as psychotic symptoms. These are also known as psychotic symptoms, and when we see that these symptoms, they respond well to medication. So they respond well. So medication, when we give, generally respond to these medications. So generally we say that positive symptoms have a good prognosis. They have a good prognosis, okay, or a better prognosis.
Question 4. A 39-year-old man reported that he washes his hands 15 to 20 times a day to the point of it taking a toll on his workplace performance. He says this is due to repetitive thoughts that his hands are contaminated with dirt. What is the most probable diagnosis in this case? Here are the options. A. Bipolar disorder. B. Obsessive-compulsive disorder. C. Schizophrenia. D. Mania. And the correct option is B. Obsessive-compulsive disorder. Here is the explanation.
So let's start with the first disorder, that is obsessive compulsive disorder or OCD. Now, as the name suggests, in OCD, patient has recurrent obsessions and compulsions. So let us try to understand what are obsessions and compulsions. So the characteristics of obsessions you can remember with the mnemonic ROSY. So R stands for recurrent. Patient has recurrent and intrusive thoughts, images or impulses. So patient with obsession reports that there are repeated thoughts which are occurring in the mind, or repeated mental images which are occurring in the mind, or certain impulses or urges are occurring repeatedly in the mind. So they are very repetitive. They may occur for hours and hours, and person does not consider them as pleasurable. O stands for patient's own. So patient acknowledges that these are his own mind's thoughts or images or impulses, and they are not imposed by others. Like for example, in thought insertion, person experiences that someone is inserting thoughts in the mind. Here the patient acknowledges them as his own. Then person also acknowledges them to be senseless. The person recognizes that these are not making any sense. They are irrational. Again, this differentiates it from delusion, where the person in delusion does not consider the beliefs to be irrational or senseless. And lastly, the person wants to get rid of these repetitive thoughts or images or impulses. He wants to suppress them. He even tries, but these are irresistible. He is not able to stop them. So this is how we define an obsession. So let us take an example. For example, a patient is having repetitive recurrent thoughts that his hands are dirty. So these are recurrent thoughts which are occurring multiple times, or maybe for hours and hours in a day. Patient acknowledges that these are his own thoughts and also acknowledges them to be senseless. He says, I know these are not making any sense because my hands are clean. I washed them few minutes back. And he wants to get rid of these thoughts. He even tries to distract himself, but he is not able to. So these are irresistible. So this is the classical example of obsession of contamination. So this is how we define an obsession. Now let us try to understand what is a compulsion. Compulsions are repetitive behaviors. For example, washing or checking, or sometimes they may be recurrent repetitive mental acts. So person is performing some acts in the mind. So from outside it may not appear that person is doing anything. For example, the person is counting something in his mind. So compulsion, as the name suggests, these are person is doing something out of compulsion. So for example, in obsession of contamination, person is having repeated thoughts that the hands are dirty, and subsequently the person, what he starts doing, he starts washing these hands, and it's not once or twice. He may do it multiple times or maybe for hours and hours. Now, so these compulsions basically person performs in response to an obsession like we've just discussed, or in a rigid or a rule-bound manner the person do these things, and the purpose is to reduce the anxiety. But of course, he is not able to suppress the anxiety.
Question 5. Lithium usage in pregnancy can lead to which of the following teratogenic effects? Here are the options. A. Cardiac defects. B. Facial defects. C. CNS defects. D. Urogenital defects. And the correct option is A. Cardiac defects. Here is the explanation.
Teratogenic effects associated with lithium. So a female pregnant female, taking lithium, it can lead to some teratogenic effect. So lithium, if taken in pregnancy, can lead to Epstein anomaly of the tricuspid valve. And the risk in lithium exposed fetus is 1 in 1000.
Question 6. A patient present in the ward when asked, "What is your name?" repeats the same sentence back to you. What is this phenomenon called? Here are the options. A. Coprolalia, B. Echopraxia, C. Copropraxia, D. Echolalia. And the correct option is D. Echolalia. Here is the explanation.
Or patient may show echolalia. Echolalia is repeating the last heard word of others. So somebody heard a word, okay, for example orange, somebody said orange and the person starts repeating that word orange.
Question 7. A patient stopped alcohol consumption for 3 days and presented with irritability, disorientation, paranoid delusions, agitation, visual hallucinations, and altered sensorium. What is the likely diagnosis in this case? Here are the options. A. Delirium tremens, B. Wernicke's encephalopathy, C. Korsakoff psychosis, D. Alcohol-induced psychosis. And the correct option is A. Delirium tremens. Here is the explanation.
So within the next 72 hours, what may develop? There may develop a very, very important alcohol withdrawal symptom, that is delirium tremens. Delirium tremens may develop. So it's a very, very severe form of alcohol withdrawal. So what is delirium tremens? There is disturbance of consciousness. Now person is in a delirium state. So this Mr. Depp, his consciousness is impaired. He is disoriented. So when the family members reach the hospitals, he's not able to identify the time. He's not able to identify the place. He's saying he's at his home, although he's in the hospital. He's not able to identify the person. So there is disorientation to time. Even in delirium tremens, there may be hallucinations, but very important to remember here, most common hallucination in delirium tremens is visual hallucination. So he's reporting maybe that there are small snakes he can see which are crawling. So visual hallucinations are more common. Of course, auditory hallucinations can also occur. And of course, other symptoms like autonomic hyperactivity tremors may also be seen. So now he's landed into delirium tremors.
Question 8. A 20-year-old lady presents with sudden palpitations, sweating, breathlessness, and a feeling like she is being choked. She had a history of a COVID-19 infection 1 year ago and fears she might die because she was positive for COVID-19. Physical examination, ECG, and laboratory workup were unremarkable. This is the first time she is experiencing an episode like this, which lasts normally for around 20 minutes. What is the most likely diagnosis? Here are the options. A. Post-traumatic stress disorder, B. Bipolar disorder, C. Depression, D. Panic attack. And the correct option is D. Panic attack. Here is the explanation.
Let's start with the first disorder, that is panic disorder. So before that, let us try to understand what is a panic attack. So panic attack is an acute, sudden attack of intense anxiety. So it is sudden and there is intense, severe anxiety with symptoms like there is palpitations, then there is sweating, patient may complain of tremors, shortness of breath, chest pain may be there, then depersonalization, which is, feeling of detachment from self, or there may be derealization, which is a feeling of detachment from the surroundings or feeling of unreality. Okay. So along with these symptoms, so there is sudden attack of intense anxiety accompanied by these symptoms. Along with this, very important, in a panic attack, there is fear of impending doom. Doom is that everything is, about to end. Impending means it is about to occur. So patient, complains that there is a feeling that everything is about to end, or there is a fear of dying. I'm dying. Oh my God. There is a fear that I'm dying, or, I'm losing control, or I'm going crazy. So this is what happens in a panic attack. Sudden onset of acute anxiety, severe anxiety, along with this fear that, I am about to die. This is what is a panic attack. Now, recurrent panic attacks, we say, is a panic disorder. So person having multiple such panic attacks is panic disorder. Now, Also, let's remember that the panic attacks which occur, they are unexpected. Okay, that means they are not restricted to any particular situation. Okay, so person can have these panic attacks anywhere, or it can occur anytime. So there are no, triggers or cues, which would occur before the onset. They could occur anytime. Okay, and generally they last for, few minutes, maybe 20 to 30 minutes, and rarely they may last even more than 1 hour.
Question 9. A 30-year-old woman brought to the psychiatric OPD by her friend says her boss is in love with her and stalks her. The woman's friend refuses her claims. What is your diagnosis? Here are the options. A. Megalomania. B. Delusion of reference. C. Delusion of control. D. Erotomania. And the correct option is D. Erotomania. Here is the explanation.
Erotomania type, it can be erotomania type if it is, delusion of love.
Question 10. What is the earliest symptom of alcohol withdrawal? Here are the options. A. Tremors. B. Delirium tremens. C. Seizures. D. Hallucinations. And the correct option is A. Tremors. Here is the explanation.
And when that blood alcohol concentration suddenly is lowered, so now what happens is that brain comes to an hyper excited state. So the continuous depressant which the brain was getting, it has suddenly withdrawn. So now brain goes in an hyper excited state, which leads to these withdrawal symptoms. So now we'll learn some of these withdrawal symptoms, so you'll understand. So a lot of such hyper excited symptoms may occur. So now when Mr. Depp is inside the room and 6 to 8 hours have passed. So from the last intake of alcohol, 6 to 8 hours have passed. So this is again based on the duration. So duration after stopping alcohol or decreasing alcohol in terms of hours. So in the next 6 to 8 hours, the person may develop tremulousness. There may be tremors. So these are the classical or the most common sign, or sometimes say the earliest sign to develop in alcohol withdrawal. So person inside, so Mr. Depp from inside the room is shaking. His hands, his body is shaking. So coarse tremors usually occur. Okay, so this is again very important, the first sign or the most common sign.
Question 11. A student had difficulty in studies and on assessment he had an IQ of 55. According to the DSM-IV criteria, he/she would fall into which of the following categories? Here are the options. A. Mild intellectual disability. B. Moderate intellectual disability. C. Severe intellectual disability. D. Profound intellectual disability. And the correct option is A. Mild intellectual disability. Here is the explanation.
Now again, this is very important. Based on the IQ, what is the various IQ range of these severities? Mild mental retardation. So we have discussed mental retardation is when the IQ is less than 70. So mild is when it is between 50 to 69. Moderate is when the IQ is between 35 to 49. Severe is between 20 to 34. And profound is when it is less than 20. So then we say it is profound mental retardation.
Question 12. A 35-year-old woman presents to the psychiatric OPD with decreased sleep, elation, and talkativeness for 1 month. She is shouting at the nurses and is uncontrollable. She also complains of irritability and distractibility. She has no previous medical issues. What is the treatment of choice in this patient for this acute state? Here are the options. A. Lithium. B. Lorgepam. C. Carbamazepine. D. Haloperidol. And the correct option is D. Haloperidol. Here is the explanation.
In pharmacotherapy, we can use some of the drugs, but it is more of symptomatic management. So we may use drugs like antipsychotics for management of some of the symptoms, psychotic symptoms like delusions, hallucinations, and even agitation. As we have discussed, some of the patient may also develop these symptoms. Okay, so drugs like haloperidol, which is a first generation antipsychotic, drugs like olanzapine, which is a second generation antipsychotic, may also be used to manage these symptoms.
Question 13. A 13-year-old boy was brought to the child psychiatrist by the parents. The parents reported that the child lies frequently at home and in school, misbehaves with the teacher, often bullies the younger kids, and has been caught stealing money on multiple occasions. What is the likely diagnosis? Here are the options. A. Oppositional defiant disorder. B. Conduct disorder. C. Antisocial personality disorder. D. Disruptive mood dysregulation. And the correct option is B. Conduct disorder. Here is the explanation.
Let's talk about the second disruptive disorder, that is conduct disorder. So what is conduct disorder? The pattern of behavior is characterized by aggression and violence of rights of others. So person may show aggressive behavior and violates rights of others, such as what kind of behavior? Like there may be physical aggression. They may start beating their fellow students, or they may threat someone to harm, or they may bully others. Destruction of property, school property, house property, or they may be involved in thefts. Then frequently they may also harm animals. Sometimes also frequently they violate age appropriate rules. For example, they may stay out at night despite parental prohibition. So parents have prohibited not to go out, but they may go out in the night. Then truancy from school may also be present. But when we take truancy from school as a symptom in these children, we say it should start before 13 years of age, then it is considered as a symptom of conduct disorder.
Question 14. A female was brought to the psychiatrist 5 weeks after her delivery. She is appearing fearful, irritable, and having suicidal thoughts since 3 weeks. What is the likely diagnosis? Here are the options. A. Postpartum blues. B. Postpartum psychosis. C. Postpartum depression. D. Panic disorder. And the correct option is C. Postpartum depression. Here is the explanation.
Postpartum depression. Okay, again 10 to 15% of the women after childbirth may experience postpartum depression. Onset, generally we say is within 3 months of delivery. Now again, in the guidelines like DSM-IV says it is within 4 weeks, but up to sometimes 3 months we can still take it as postpartum depression. There is an increased risk of depression in future. If a person has postpartum depression, there is an increased risk of developing another episode of postpartum depression in the future pregnancies. Now again, here the symptoms, there is depressed mood, insomnia, change in weight, these are seen. And now again, tearfulness, mood lability, again as in postpartum blues is present. Now more severe form of symptoms like anhedonia, guilt, they are often present. Suicidal thoughts of harming the baby, again they are also present sometimes. And there may be a history of mood disorder, previous history may be there, and family history also may be seen. It's not always, but again there may be strong association with this. Okay, so again this is typically telling me that patient is not having blues, but now patient is having a depressive episode.
Question 15. Which of the following is related to McNaughton's rule? Here are the options. A. IPC 84, B. IPC 85, C. IPC 86, D. IPC 87. And the correct option is A. IPC 84. Here is the explanation.
Section 84 of the IPC, it embodies McNaughton's rule. So this section 84 of the IPC states that nothing is an offense which is done by a person who at the time of doing it, by reason of unsoundness of mind, is incapable of knowing the nature of the act, that he is not able to know what act he is doing, the nature of the act, or that he is doing what is either wrong or contrary to the law.
Question 16. Negative symptoms of schizophrenia are all except. Here are the options. A. Overactivity. B. Anhedonia. C. Allogia. D. Apathy. And the correct option is A. Overactivity. Here is the explanation.
Negative symptoms, these are the negative symptoms. So as we have discussed how these negative symptoms occur, they occur because of decrease in dopamine in the mesocortical pathway. Okay, so let us try to understand these negative symptoms. So first negative symptom is anhedonia. Anhedonia, what is anhedonia? There is a decrease in interest or loss of interest. So in activities which earlier the person used to enjoy, like going for movies or playing some sport, these patients now don't show interest in these activities. So this is anhedonia. Next is avolition. Next is avolition. What is avolition? Avolition is loss of will or drive. So family members say, now, we give him any task, anything, he does not show any will to do that. Okay, as if there is loss of, willpower or loss of motivation. This is avolition. Then next is affective blunting. So if you remember in the basics, you've discussed flat affect or blunt affect. So that is inability to express emotion. So, again, you're talking, something good, you're talking about some good event. Let us say, the patient got promoted few months back, but the patient is just looking like this. There is no change in the emotions. Okay, or you talk about something sad in his life. Let us say, a few months back, there was a death in the family. Again, the patient does not show any, emotion. He just looks like this. So this is affective blunting. Then there is asociality. Asociality. There is a decrease in the drive to socialize. So family members may say that, we take him outside to, in social gathering, he does not socialize, or someone comes and meet him at home, he does not, socialize with them. So there is asociality. Okay. Then next is alogia. So again, from the name itself, you can remember what is logia. Logia means word. If you remember, we talked about neologism in the basic. Neologism was new word. So logia means word. So alogia means there is a decrease in the verbal communication. So family members say that, the mother may say that, I'm talking to him for 5-10 minutes, I'm speaking, but he may just reply in 1 or 2 words, or he may not reply anything. So there is a decrease in the verbal communication or verbal output. Next is attention deficits. So again, there is, in these patients, attention, is also seem to be decreased. Okay, so, there will be, in social gatherings, they would have, inattention. And even while you're talking or interviewing, it will seem that, they are not able to pay, attention. So there is decrease in attention. And lastly, there is apathy. There is loss of concern, lack of concern. So again, family members may say that, we come to him and we are crying in front of him, but he does not show any concern, as if, there is no concern there. Okay, so this is lack of concern. So these are some of the negative symptoms which are seen in schizophrenia. Now, if you see, why are they called negative symptom? If you can see, everything is, everything is minus, everything is getting reduced. Everything is getting reduced. So that is why these are known as negative symptoms.
Question 17. Most common acute organic mental disorder. Here are the options. A. Delirium. B. Dementia. C. Amnesia. D. Anxiety disorder. And the correct option is A. Delirium. Here is the explanation.
Delirium, out of all these organic mental disorders, it is the most common organic mental disorder. So out of all these disorders, it is the most common.
Question 18. Jet black pigmentation of the tongue with tactile hallucinations is a feature of. Here are the options. A. Heroin. B. Opium. C. Alcohol. D. Cocaine. And the correct option is D. Cocaine. Here is the explanation.
Due to the vasoconstriction, because of the sympathetic activity, because of increased in norepinephrine, so it can cause, when it is snorted, it can cause rhinorrhea, nosebleed, and even it can cause nasal septal perforation. So long-term use can even cause nasal septal perforation. So a person consuming a substance comes with such complaints, so you may suspect cocaine. Okay, it can also cause jet black pigmentation of the tongue, after long-term use. So these are the effects of the cocaine in the body after prolonged use. Now, other methods include intravenous, subcutaneous route also it can be consumed. Okay, smoking cocaine, it is also known as freebasing. Okay, so when one smokes cocaine, it is this is known as freebasing. So basically, freebasing involves mixing impure cocaine with chemically extracted pure cocaine. That is the freebase. So freebase is the pure cocaine which is mixed with the impure form, and then it is smoked. Okay. Now there is also a form of cocaine that is known as crack. So crack is basically a freebase form of cocaine. It is so it's a very pure form of cocaine, and it is highly addictive. Even one time use can also cause intense craving. Okay, so it is one of the pure forms of cocaine known as crack. Now, cocaine is sometimes used in combination with opioids like heroin. So many times people consume, they mix cocaine with opioids like heroin, and this combination produces very effective, very addictive. So this combination is known as speedball. So again, important, please remember what are speedballs. So when someone mixes cocaine and opioids like heroin, this is known as speedballs. Now, what are the adverse effects of cocaine? So let us understand some of the adverse effects, on the body. Now, it's a potent sympathetomimetic drug. We have discussed it increases norepinephrine. So it causes vasoconstriction. It increases the heart rate. So, in the peripheral vessels, it may cause hypertension. Also, it may cause damage to end organs such as brain, kidney, intestine. So it causes damages to these organs. Also, it causes vasoconstriction, in the coronary blood vessels, and also, there is an increase in the myocardial demand. So again, this may lead to certain cardiac abnormalities. Myocardial infarction may also occur after cocaine use. So again, these are important adverse effects of cocaine. Now, what are the signs and symptoms of cocaine intoxication? When someone consumes cocaine, the person, reports of feeling of euphoria. There is pupillary dilation. Then patient may come, report of, since there is adrenergic, sympathetic activity, tachycardia, hypertension, sweating. Again, all these have been, asked previously, So please remember, it increases the sympathetic activity, it causes these symptoms. Then sometimes it can cause respiratory depression, even cardiac arrhythmias, even seizures. So it is one of the important drugs which is notorious in causing seizures. So again, please remember, it is one of the notorious drugs which can also cause seizures, like GTCS seizures may occur after cocaine use. Then it may also be associated with auditory hallucinations, paranoid ideation. So, the person may not be up to a level of delusions, but person may suspect someone is harming me. So, maybe up to level of ideas. Then this is again important. This we have discussed even in the basics. Cocaine use also can cause tactile hallucinations. This is known as cocaine bugs. So person may feel that insects are crawling under or over the skin. So this is again important. This is also known as formication or magnum bugs. And what physical finding you may get, when someone has these symptoms, there may be, so the physical finding may be that patient may have scratch marks. Okay, scratch marks may be there over the body. Okay.
Question 19. True for lithium. Here are the options. A. Delayed absorption. B. Narrow therapeutic index. C. Protein bound. D. Can be given safely in renal dysfunction. And the correct option is B. Narrow therapeutic index. Here is the explanation.
So blood sample should be taken 12 hours, plus minus 30 minutes after the last dose. So suppose the patient has taken in the night, the person has taken the lithium, then in the morning, 12 hours later, before giving the next dose, we have to take the samples, 12 hours. So there should be a gap of 12 hours. Or if the patient has taken it in the morning, so 12 hours later in the night, before giving the night dose, one has to take the blood to check the lithium levels. Now the therapeutic range, it is a narrow therapeutic index. The therapeutic range is 0.5 to 1.5 milliequivalent per liter. In acute mania, the range of the level should be between 1 to 1.5 milliequivalent per liter. So we adjust the dose so that the range is between 1 to 1.5 milliequivalent per liter in blood. And for maintenance, it should be around 0.6 to 1.2 milliequivalent per liter. Toxicity generally starts when it is more than 1.5 milliequivalent per liter.
Question 20. A boy with normal language milestones spends his time seeing her own hands and does not interact with others. What likely diagnosis is? Here are the options. A. ADHD. B. Antisocial personality disorder. C. Asperger's syndrome. D. Rett's syndrome. And the correct option is C. Asperger's syndrome. Here is the explanation.
Asperger's syndrome again is more common in boys, that is males, than girls. Now one very important point about Asperger is, now we have discussed that there were earlier 3 core criteria. The third, which has now been removed, is language impairment. But Asperger's syndrome from the beginning never had any language deficit or language impairment. So these exhibit no language delay. Language is not impaired in these children. Okay. There is impairment in non-verbal communicative gestures. So in social communication, the non-verbal communication. So sometimes, let us say your friend is, or your known person is standing very far from you, your voice may not reach. So you may make some gestures, or you may show some gestures to ask him to come to you. Okay. So these children have problem in these non-verbal communicative gestures, and of course there may be repetitive patterns of behavior can be seen. Now usually in Asperger's, the IQ, the social skills may not be that much affected, and generally factors which are associated with good prognosis. So in a child with Asperger, if it has a normal range IQ or better social skills, these children may have better prognosis.
In the next video of FMGE Recall Rush, we have some crucial PYQs from microbiology. Like and subscribe if you learned something new today. See you tomorrow.